Greetings, YouTube. So I went to see my primary care physician today, and while having the conversation with her, I discussed the fact that I was happy with my new levels of serotonin. I said having a full, allotment of serotonin now has given me. I said, and the good news is it's given me a lot more headspace for thinking. And I said, and the bad news is it's given me a whole lot more headspace for thinking because it's really ramped up my anger at a lot of things in the world, from the very petty things like the people on my previous shift from me, second shift, screwing me over every day, to larger issues like the exploitations committed by capitalism against both humanity and nature, white nationalism, the patriarchy, things like that, toxic masculinity. So there were a lot of things occupying me, and I said, that's one of the reasons that my stress and my anxiety levels were higher at the moment, because I'm currently still waiting for a slot to get a vaccine. So I'm still kind of feeling constrained and kind of trapped in a very small sphere because I can't get out and do things I want to do, and I'm hoping that enough Americans get the vaccine so that we can, then be able to have lives somewhat similar and hopefully better than we had before the plague times. And then she asked me if I'd had my shingles vaccine, and I thought I had one a while back, but she doesn't think I had. I got to be honest. That's why I have a doctor with medical records. I don't keep track of these things in my head. And she said that it's rather expensive, so I should check with my insurance company to make sure that they cover it, because if they don't cover it, it's like a $700 charge. And I said that shouldn't exist. I said I'm a big proponent of universal health care. And she said, well, that's a much bigger issue. I said, no, I said, we should have it. That's where the conversation ends. It isn't a big issue. My doctor thinks it's a big issue because my doctor has been born and raised and educated in America. And Americans are conditioned to just accepting horrible things as the state of the world. And the idea that we could have universal health care in this country is seen as some kind of pie-in-the-sky, unattainable goal, even though 32 of the 33 industrialized nations of the planet have pulled it off. And we're the only ones that hasn't. Now, I'm not saying that my doctor is opposed to it, because she isn't. But she just has a hard time of wrapping her brain around the fact that it is attainable, and all we have to do is say, make it so. Do it. Just tell pharmaceutical companies, you can't charge more than X for drugs. Period. Say 5 times the cost of production, not research. They shouldn't be doing research. We, the people, should be doing research. The FDA should have a research branch doing research. That's where all the researchers should be working, for us. And then we just hire pharmaceutical companies to produce the drugs that we own, because drugs that save lives should belong to the people, not to private corporations. We just get rid of the middlemen between the people and the medical providers. We don't need the insurance companies. We, the people, say this is how much we're going to pay for these procedures based on, what other countries pay for these procedures, and making sure that, the doctors make the living that they should. But they essentially just become like any other civil servant, the way that cops and park rangers and firemen and everybody else is. They become servants of the people, which is how it should be. And there can be private doctors, and there wants to be an ancillary private insurance system out there that is for people who are wealthy enough to want to be outside the public system. I got no problem with that. But for the general public, there should just be a public system that covers all of your medical needs, your hearing aid needs, your dental needs, your vision needs, everything. And I believe that Bernie's system, if we were to have the plan that Bernie Sanders has come up with, I think that my wife and I would be paying like something like $1,200 or $1,300 a year, which is considerably less than we pay now. Because that, again, it's a package deal. That's the totality of it. It covers everything. So we're not going to get surprised with the $700 shingles vaccine, because that wouldn't exist. That shouldn't exist. Shingles isn't a option you desire. It's not like having a nose job that you don't need for survival. It's not a vanity project. It's a disease that anybody can get, and if you're not vaccinated vaccinated for it, it can be life-threatening. We shouldn't have to pay for vaccines that prevent people from experiencing life-threatening illnesses. So whenever somebody says, well, how are we going to pay for it? We pay for it with tax dollars. We tax the billionaires. We cut the military. We stopped giving subsidies to the fossil fuel industry. There are ways to do this. We can look at 32 other countries to see how they do it, to give us examples to go by. And there were lots of smart people who have been working on this for decades. We can turn to them. We have the experts. Don't let the conservatives make you think that it's an impossible goal, because it isn't. It's attainable. It's doable. And if we don't do it, that just means we let tens of thousands of Americans die every year. Not just get sick. That's hundreds, millions of Americans get sick every year because they don't have the right kind of coverage. No, we let tens of thousands of Americans die. And that's not counting the plague. It's doable. We can achieve it. We the people. We just have to look at the politicians and say, make it so.